Welcome to the Bolder Healthier Champions webinar series. I'm Dr. James Barnes, a GP trainee working within Birmingham City Council. In this month, we'll be looking at diabetes and its impact on the Birmingham population. These slides will broadly outline what diabetes is, how big the problem is, and where public health and the Bolder Healthier Champions can help to make things better. Before we start, I think it's important that we take a bit of a look at the background of diabetes, what causes it, what some of the symptoms are, and maybe some of the medications that we can use to treat it. So diabetes is a lifelong disease which is caused by uncontrolled high blood sugar levels. Broadly speaking, there are two main types, which we'll look at in more detail in a moment. In the early stages, diabetes may be treatable with lifestyle changes alone, but many may need medications such as tablets or even insulin injections for the rest of their life. Without treatment, it can be very serious, causing problems with kidneys and eyesight, and can even lead to limb loss, heart attacks, and stroke. This damage builds up over a number of years, so getting diagnosed and treated early can make all of the difference. To explain a bit further about the different types of diabetes, there are a number of different types. One of these is gestational diabetes, which is associated with pregnancy and can put you at an increased risk of developing other types of diabetes later on in life. For the purpose of this webinar, however, we're just going to focus on the two main types of diabetes, known as type 1 and type 2. Type 1 diabetes normally starts at a younger age, but can actually be seen at any point during life. It happens when the body attacks the pancreas gland, stopping the production of insulin. Insulin is a hormone which acts as a key, allowing sugar to get into the cells of the body and fuel all of its processes. Whilst there's ongoing research on the disease, it's not currently preventable, and people with type 1 will need lifelong insulin injections to replace that not made by the pancreas. With this, Bolder Healthier Champions can help by making sure that people with type 1 diabetes are supported at work and in schools, and as well as being supported in the community with their health needs. Type 2 diabetes is more related to insulin resistance, where the supply of insulin can't keep up with the needs of the body, and the insulin doesn't work as well as it could do. It's linked with obesity and can be prevented with lifestyle changes. We'll look later at pre-diabetes and the role in screening. Bolder Healthier Champions can have more of a role here in terms of promoting healthier lifestyles and raising awareness, and most of this talk will focus on this. But what kind of symptoms might we see in someone with diabetes? Well, in someone who has diabetes, the uncontrolled high levels of sugar in their blood can cause increased thirst and drinking more, which in turn can cause someone with diabetes to then need to go to the toilet more often, such as perhaps having to wake up during the night to go to the bathroom. Because the lack of insulin stops sugar getting into the cells where it's needed, people may experience things like low energy, being slow to heal cuts or bruises, or may even lose weight unexpectedly. However, it should really be noted here that everyone is completely different, and some people might have very few symptoms at all, despite being quite unwell. In some cases, some people have only found out when they end up in the hospital after becoming seriously unwell. So if you're at risk of diabetes, it's worth getting checked early. So how big is the problem for our communities in Birmingham? This infographic by the former Public Health England gives some more detail. At the current trend, 1 in 3 people in England will be obese by 2034, and 1 in 10 will have diabetes. The financial cost of this is currently £8.8 billion a year, around 9% of the annual health budget, and this will only rise over time. This is especially a particular problem in Birmingham, where rates are around 50% higher than the national average. I'll just give you a few moments to read some of the statistics on screen. So what sort of long-term problems do we see in patients living with diabetes? Well, on screen at the moment, you can see just a few of the health problems that can be seen in people living with diabetes. Often, these are seen more often in those with prolonged periods of having high uncontrolled blood sugars. People who adopt lifestyle changes and control their sugars well with medication tend to get much less serious complications. By reducing the number of people living with diabetes and helping those with diabetes to get better control, we can lessen the number having to live with these awful complications. Before we move on to look at what we can do to help, it's worth exploring the things that put someone at an increased risk of type 2 diabetes. The most important risk factor is obesity. Those with a body mass index (BMI) of over 25 and a waist circumference of more than 31.5 inches in women and 37 inches in men are at a 7-fold increase risk of diabetes compared to those of a more healthy weight. Family history and age play a part as well, with older people and people with many family members who also have diabetes being at higher risk. Deprivation is also a significant factor, with the prevalence of type 2 diabetes 60% more common among individuals in the most deprived quintile compared with those in the least deprived quintile in England. We also know that certain groups, particularly in a diverse community such as Birmingham, are at least 3 times more likely to develop type 2 diabetes than the white population. This is due to a mix of genes that make some groups more likely to develop diabetes, as well as non-genetic differences, such as diet, lifestyle, access to healthcare, and deprivation. As I'm sure you can see, a number of these are what we call modifiable risk factors, and the hope is that by targeting these through a number of interventions on an individual and community level, we might help build a bolder, healthier Birmingham, with lower rates of diabetes as well as other health problems. So now that we've had a good look at some of the underlying background of diabetes, it's worth taking some time to look at what we can do to try and reduce the overall incidence of diabetes in our community. So what can we do to prevent diabetes? Broadly speaking, the 3 main NHS goals for preventing diabetes are similar to those that you may have seen in other campaigns. Helping people to achieve a healthy weight, supporting healthy food choices, and achieving a good amount of physical activity all contribute towards reducing the number of people with poorly controlled diabetes. These can also be separated into things that would help for those who already have diabetes, but also more community-wide interventions to prevent people getting diabetes in the first place. Some of the ideas of schemes and interventions that are already in place are shown on screen now, and it might be worth taking a few minutes to think about which of these you may have seen yourself, or which you may be able to implement. When we're talking about preventing diabetes, this is where a really important concept known as pre-diabetes comes in. Pre-diabetes is where your blood sugars may be higher than normal, but not high enough to be classed as diabetes. It doesn't cause symptoms, but it can be seen as a tipping point where early intervention can potentially prevent someone from then tipping over into full diabetes. One way of knowing if you might be at an increased risk of type 2 diabetes is by using the Know Your Risk calculator, which is found on the Diabetes UK website. You'll need an accurate measurement of your height, weight, and waist circumference, as well as some bits of information about your background, and it will tell you your risk of developing diabetes over the next few years. If you are at high risk, that's the time to think about seeing your GP for a routine blood test. Now we're going to move on to look at some of the ways in which you, as a Bolder Healthier champion, can help improve things in your community. In terms of ways in which you, as Bolder Healthier champions in the youth sector, can work to help, I'd like to look at an informing, promoting, and helping approach. Awareness and information about diabetes is key, so passing on the information that you have to members of your community, including the Know Your Risk calculator we mentioned, is absolutely vital. Some of the young people that we see in our schools and youth centres will have lots of relatives that may be at an increased risk, so trying to promote that Know Your Risk calculator will really help. In terms of promotion, using diabetes as yet another reason to promote healthy living in your respective spheres of influence is also crucial. Whether promoting community sports events or a push on healthy eating, even small changes can make a big difference in the long run. And many of the interventions that we're talking about today to try and prevent diabetes will also help with things like coronary heart disease and strokes. As mentioned earlier, people living with diabetes in the community often have extra needs and may benefit from extra support. We especially know that the rates of poor mental health are higher in those living with diabetes than those without. Looking out for those most vulnerable and pointing them to some of the resources at the end of this webinar can be life-changing. This is particularly important with young people who maybe have only just had a diagnosis of diabetes, which is going to affect them for the rest of their lives. Having discussions about health or about health problems can sometimes be very challenging. It's something that I've been doing for a number of years, but sometimes certain conversations still catch me on the back foot. So when offering support for diabetes or for any other health problem, it can sometimes be used as a simplified approach. Here I'll talk about using the Ask, Assess, Act model. To start with, try using an open question, one that doesn't have a yes or no answer. Be understanding. Some people might not want to discuss a health problem, especially in front of others. Assessing then comes down to having an open-minded discussion with someone as to what might help. Try to ask them to come up with ideas at this stage, rather than just jumping straight to the solutions you see, and the person is more likely to go through with it. Once you've made a decision together, acting then comes down to finding useful solutions that will help make the person's working day easier. On screen, you can see an example where someone is talking to someone about their recent diagnosis. In terms of where to go to find or offer information, there's a whole host of information currently out there on the internet about diabetes, but it's really important that we use sources that we can trust. Diabetes UK is a charity that works closely with the NHS and has a fantastic wealth of information online. The NHS website itself also gives broad information about a number of health problems, not just diabetes, and is a really good source of information. For people that are currently suffering with diabetes, their consultants and specialist nurses can offer advice, and they'll often be given contact numbers at their first appointments. For people that are worried about their blood sugar levels, seeking a GP or another healthcare professional is always a good start. It's also worth being aware of the Mind website, which offers mental health support, as we know that anyone with a long-term condition is more at risk of poor mental health, including those that have just been diagnosed with diabetes. So in summary, diabetes is a significant problem, with many knock-on complications for the residents of Birmingham, who are particularly at risk. And at current trends, this is likely to only increase over the next decade. By making every contact count, we can aim to turn the tide on new diabetes diagnosis, and also to improve the lives of people currently living with diabetes. I'd like to finish by thanking you for taking the time to listen to this webinar series.